The Biden regime has mandated that all employees working for employers with over 100 workers must either be vaccinated against COVID-19 or undergo weekly testing. All employees at healthcare facilities that receive Medicare or Medicaid must be fully vaccinated. This obviously raises some moral issues. While some employers had already implemented their own vaccination and testing requirements, this changes the situation. It is one thing for an employer to impose requirements on their employees, and another for the federal government to use its coercive power to compel employers to compel their employees to get vaccinated or tested. Since I've already written about the ethics of employers requiring vaccination, I'll focus in this video on the ethics of the state requiring employers to require vaccination or testing. I will of course leave the legality of the mandate to the lawyers. Now, determining the ethics of the mandate is a matter of sorting out the legitimate limits of the coercive power of the state. That is, whether the state has the moral right, or perhaps even an obligation, to use its power to accomplish. The evaluation should be done in a consistent and principled manner, as opposed to, for example, deciding what one should do and based on what one happens to be mad about at any given moment. Now, aside from the anarchists and a few others, most political theorists agree that a basic function of the state is to protect its citizens from harm. For those who value liberty, the actions taken in support of security need to be weighed against the cost of the imposition. While there are ways to approach this, a basic utilitarian approach is generally a sensible starting point. In the case of Biden's mandate, the idea would be to weigh the harms of the mandate and its cost against its benefits in protecting citizens. This approach is obviously nothing new. To illustrate, after 9/11, and after every other terrorist attack since then, the United States has purported to act to increase security against terrorism. These always come with a cost, and the cost is, in addition to the monetary cost obviously, cost and increased limits on liberty. For example, we've lost the liberty to bring liquids over a certain volume onto a plane. As other illustrations, state governments have passed laws restricting liberty by purporting that they protect people from the alleged dangers of critical race theory, to guard against the purported threat of transgender people, and to defend against supposed voter fraud. Biden's mandate is thus in crowded company. He is using the coercive power of the state and justifying it by asserting there is a danger that warrants its use. But is Biden and his supporters, are they right? Now, people do tend to take a stance based on how they feel about a matter, or what they think other people feel, rather than based on a theory of the state. This is usually because most people, even national politicians, have no such theory. I admit to not having a complete theory, but I do have the basics of a theory. As usual, for those familiar with my stuff, I'm operating within a liberal John Locke, John Stuart Mill framework of political philosophy. I accept that people should be free, that the purpose of government is the good of the people, and that liberty should only be infringed upon based on the principle of harm. I also favor small government. The state's use of coercive force should be kept to a minimum. My first consideration in assessing this mandate is determining whether it falls under the legitimate use of this power of the state to compel. So the issue is whether requiring vaccination or testing by employers is a legitimate use of the coercive power of the state. In the context of mandates that impose on liberty, as I've noted before, I generally follow John Stuart Mill. Liberty can only be justly restricted to prevent harm to another. COVID-19 is obviously a dangerous and infectious disease. Variants have also appeared that are more infectious than the original, and it is reasonable to expect that as the virus continues to go unchecked, the more likely it is that increasingly dangerous variants will arise. As such, the unvaccinated do harm others by providing the virus with the opportunity to change, thus becoming a greater threat to everyone. they are literally helping the enemy of humanity become stronger. There's also the fact that the unvaccinated can spread the infection to others. These include people who cannot be vaccinated, and obviously people who cannot be vaccinated for medical reasons. They're not forced to do so by the mandate. And they would be morally not accountable for this because they can't get vaccinated. So this disease can spread to people who are not vaccinated for medical reasons and other reasons that are legitimate. And as such, the unvaccinated are aiding the enemy of humanity by creating basically new viral weapons for COVID and risking other people by spreading the disease to them. There is also an impact on the healthcare system. While the American healthcare system is quite good for people who have the resources to pay for the care and either live near to these facilities or can travel to these facilities easily, it has long been a problem for people who lack these resources and access, most commonly Americans living in rural areas, which generally lack healthcare access comparable to urban centers. Now, this problem is, of course, being compounded by the unvaccinated. As this is being presented, being recorded, 5 states have apparently less than 10% of their ICU beds left, and hospitals are literally filling up, largely because of having to hospitalize people who are unvaccinated who got COVID. As such, even if an unvaccinated person somehow doesn't infect someone else when they get sick, if they get very sick, they still use up limited healthcare resources, thus doing harm to others who need access to that care, and sometimes, tragically, people even die from this lack of access. So it is literally killing people. Now, one could attempt to counter these claims by asserting that the vaccine is dangerous, but the best available evidence shows this is untrue. Trump was vaccinated early on, thus showing that he seems to believe it is safe and effective. Even the governor of my adopted state of Florida, DeSantis, was also vaccinated, showing that he presumably thinks it's safe and effective. Most Republican politicians are also vaccinated, so they also would seem to believe it is safe and effective. As such, the mandate would seem to be justified by the principle of harm. But even if the mandate would prevent harms, this does not entirely settle the issue of whether it is a just use of the power of the state. A second consideration is whether the significance and nature of the alleged harm warrants expending public resources to enforce the mandate. Harms vary in significance, and even significant harms might not be the right sort of harms that justify the use of the coercive power of the state. Now, as argued above, the harm presented by the unvaccinated is significant. The unvaccinated are infecting other people, serving as effectively weapon laboratories for the virus, and wasting limited medical resources with their easily avoidable illness. They could have just got vaccinated. But are these the right sort of harms to warrant using the coercive power of the state? On the face of it, these do seem to be the right sort of harms. After all, these harms are illness, death, and wasting of medical resources. The most basic function of a state is to protect the lives of its citizens from dangers, and this mandate is aimed at this goal. As such, it would seem to be warranted. Now, since it is primarily Republicans who oppose the mandate, it is instructive to see what sort of things they consider as legitimate uses of the coercive power of the state. One example is that the Texas House recently voted, in an impressive assault on free expression, to defund sports teams that do not play the national anthem at games. This does not seem to prevent any meaningful harm, and in fact causes harm by using the coercive power of the state to force teams to express what the Texas lawmakers want them to express. And in case you're wondering, yeah, I'm fine with the national anthem being played, but I think that should be a choice. If you're making people play the anthem, that is coerced speech. That's something the Republicans purport to really hate, except, of course, when they are doing it, because that's how politics works. Now, if the Republicans think that this warrants the use of the coercive power of the state, then they should be incredibly enthusiastic about Biden's mandate, since it addresses a real harm, and not just whatever non-harm arises if a team says they're not going to play the national anthem for some reason. Now, Republicans have also been busy passing laws to prevent the teaching of what they call critical race theory, and imposing various trans bans aimed at imposing restrictions on trans people. When pressed for actual examples of harms these laws are intended to address, they have little but vague claims about people being concerned that something might happen. But if Republicans truly believe that the coercive power of the state should be deployed against citizens when there is even just some concern that something might happen, they should be on board with a mandate aimed at addressing a deadly pandemic. Obviously, I understand that the Republicans are not operating from the principle of harm. They're operating from rather different principles, those that make it acceptable to force sports teams to play the national anthem, while also making imposing a vaccine mandate to fight a deadly pandemic somehow tyrannical. My third and final consideration is the issue of whether the harm is adequately addressed by existing laws or other means. If the harm is already being addressed adequately, there's no need for the state to get involved with a new mandate. While most Americans did act in an ethical, self-interested, and rational way by getting vaccinated in the middle of in the course of a deadly pandemic, the limits of voluntary compliance seem to have been reached. Unfortunately, this has not been enough. New variants are sweeping through the unvaccinated as Republican leaders rage against efforts to keep Americans from getting sick and dying, to the cheers of their apparently suicidal base. Because of the failure on the part of some Americans, and the active Republican obstruction of efforts to combat the pandemic, the federal government does need to act to protect American citizens from needless and avoidable illness and death. As such, the mandate is warranted. Stay safe, and I'll see you in the future.